Vaginal and vulvar cancers are really low yield and are included to round out the discussion of GYN cancers, just for the sake of completeness. Let's talk about vulvar cancers first. And we're going to stick to the stuff you have to know for the test rather than trying to be all-inclusive. When it comes to vulvar cancers, you want to know three things: squamous cell carcinoma, melanoma, and Paget's. This is a little weird because generally squamous cell and melanoma are sun-exposed areas, and the vagina is usually not a very sun-exposed area, but it can definitely get these cancers. Now, they're all going to be diagnosed after you identify a lesion on inspection and get a biopsy, so chances are that's not going to be the question they ask. Squamous cell carcinoma and melanoma on the vagina will present the same way. They're both going to be black and itchy. You can use the same A, B, C, D, E that you learn about in general surgery as well as in the dermatology lectures, but really, in a gyne question, it's going to be black and itchy, get a biopsy. Paget's disease, on the other hand, is going to be a red lesion, and that makes it a great board question. Red lesion on the vagina that is itchy is Paget's. And unlike Paget's disease of the breast, which means invasive adenocarcinoma, patients in trouble, Paget's disease of the vagina has a very good prognosis. In thinking that way, squamous cell carcinoma and melanoma are both black and itchy, both diagnosed by biopsy, and can invade, so therefore you're likely to do a more invasive procedure. That is a vulvectomy and lymph node dissection. The idea here is that vulvectomy can cause sexual dysfunction, so what you want to do is try to remove as little tissue as possible, but also maintain that the person doesn't have a metastatic cancer. So you're going to be more aggressive for large lesions or those that are deep. For squamous cell carcinoma and melanoma, you're more likely to take the risk of full vulvectomy because of the chances of metastasis. Whereas Paget's, a superficial lesion, you may only do a wide local resection to preserve the vulva. But recognize that you can choose either one of these based on the depth or involvement of the cancer. As a review, as an advanced organizer, here's a picture. Melanoma, black lesion in the middle of the vulva because it can invade. Squamous cell carcinoma, black lesion in the middle of the vulva because it can invade. And then Paget's disease, red lesion, superficial, generally does not. And the way you're going to get here is generally pruritus. And vulvar pruritus generally is not cancer. So you're going to start simply with inspection. And if you don't see any lesions, or you see an infection, it's not cancer. But if you do see a lesion, you're going to biopsy, and you're either going to get squamous cell carcinoma, melanoma, or Paget's. And based on the depth of invasion and how invasive the cancer appears, squamous cell carcinoma, melanoma, remember vulvectomy, lymph node dissection. And Paget's, because it is generally more superficial, only local resection. And then for vaginal cancer, there's even less to know. You're going to have either squamous cell carcinoma or clear cell adenocarcinoma. And everything you know about cervical cancer is true for vaginal cancer, that's squamous cell carcinoma. Wherever HPV goes, it can cause squamous cell carcinoma. Wherever semen goes, HPV can go. So cervix, vagina, oropharynx, anus, all of those can cause some form of HPV-related cancer that's generally squamous cell. The same thing is true for everything you know about cervical cancer, except that you don't do a PAP on the vaginal wall. For the test, a great board association is adenocarcinoma. If you see a grape-like mass in the vagina, not to be confused with a molar pregnancy that comes out of the cervix, a grape-like mass in the vagina, look for DES exposure. This is a great board association question. Drug leads to cancer. But the thing is that DES hasn't been used in 50 years. So the person who's in front of you right now with adenocarcinoma and a great black mass in her vagina, then you need to look at her mother. That is, when the patient in front of you was in utero, did her mom get DES? If yes, there's your explanation for your adeno. That association is great for the boards, but you probably won't see it in real life. This is vaginal and vulvar cancer, rounding out the discussion of gynecologic cancers. That's vaginal and vulvar cancer.